What if your horse's long, shaggy coat wasn't just a sign of aging? What if the weight loss, the loss of top line, or even repeated laminitis episodes were actually signs of a deeper progressive disease? Cushing's disease, more accurately known as Pituitary Pars Intermedia Dysfunction, or PPID, is one of the most common endocrine disorders affecting older horses. Yet, despite how common it is, many horse owners still misunderstand what it actually does inside the body. In this video, we are going to break it down in full. We will explain what PPID is, how it develops, what symptoms to look for, and most importantly, how it can be managed so horses can continue to live comfortable, healthy lives. Cushing's disease in horses, or PPID, is a progressive neurodegenerative and endocrine disorder that affects the pituitary gland. The pituitary gland is a small structure located at the base of the brain, but has a massive role in regulating hormones throughout the entire body. It controls processes like metabolism, stress response, immune function, and even hair growth. In a healthy horse, the pituitary gland is tightly regulated by the hypothalamus, which produces a neurotransmitter called dopamine. Dopamine acts as a braking system. It keeps a specific region of the pituitary gland called the pars intermedia from becoming overactive. In horses with PPID, the neurons that produce dopamine begin to degenerate over time. As dopamine levels decrease, the pituitary gland loses that regulatory control. The pars intermedia becomes overactive and starts producing excessive amounts of hormones. One of the most important of these systems is ACTH, or adrenocorticotropic hormone, which plays a key role in the body's stress and metabolic systems. To understand why PPID causes such widespread problems, it is important to understand the hormonal pathway involved. It goes from the hypothalamus to the pituitary gland, which produces ACTH, to the adrenal glands to cortisol. In a healthy system, this pathway, known as the hypothalamic pituitary adrenal axis, or HPA axis, is carefully balanced. The hypothalamus signals the pituitary gland, which releases ACTH, which then stimulates the adrenal glands to produce cortisol and related hormones. In PPID, the overproduction of ACTH disrupts this balance. The adrenal glands are overstimulated and normal regulation of hormones becomes distorted. This leads to significant changes in the horse's metabolism, immune function, and ability to regulate stress. Over time, these disruptions begin to show up as physical and clinical symptoms. The symptoms of Cushing's disease in horses often develops gradually, which is why they are sometimes mistaken for normal signs of aging. One of the most recognizable signs is hypertrichosis, which is the growth of abnormally long, thick, and often curly coat that does not shed properly. This is different from a normal winter coat because it persists into warmer months. However, PPID affects far more than just the coat. Horses with PPID often experience muscle wasting, especially along the top line, which can give them a hollow or weak appearance. They may develop abnormal fat deposits, such as crusty neck or fat pad around the tailhead. Many horses show lethargy, reduced performance, or changes in attitude. They may drink more water and urinate more frequently. One of the most serious and common complications is laminitis, which can occur repeatedly and sometimes without an obvious dietary cause. This is often linked to underlying metabolic dysfunction. Additionally, horses with PPID frequently have a weakened immune system. This can lead to recurrent infections, delayed wound healing, and increased susceptibility to parasites. The primary risk factor for PPID is age. Most horses diagnosed with this condition are over the age of 15. Although younger horses can be affected in rare cases. The disease is caused by the gradual degeneration of dopamine-producing neurons in the brain. This process is similar in some ways to neurodegenerative conditions seen in humans, where specific types of neurons are lost over time. There is also evidence that oxidative stress may play a role in damaging these neurons. However, the exact cause of this degeneration is still not fully understood. Genetics, environmental factors, and overall metabolic health may all contribute to the development of PPID, but ongoing research continues to explore these connections. Diagnosing PPID requires a combination of clinical observation and laboratory testing. Veterinarians typically measure ACTH levels in the blood. However, interpreting these results requires careful consideration because ACTH levels can vary naturally depending on the season, especially in the fall when levels tend to rise. Because of this, veterinarians use seasonally adjusted reference ranges to improve diagnostics accuracy. In some cases, a TRH stimulation test may be used to provide additional confirmation. This test evaluates how the pituitary gland responds to stimulation and can help detect PPID in earlier stages. Early diagnosis is important because it allows treatment and management strategies to begin before more severe complications develop. Although there is no cure for Cushing's disease in horses, it is a condition that can be effectively managed with the right approach. The primary medication used to treat PPID is Pergolide mesylate. Pergolide acts as a dopamine agonist, meaning it mimics the effect of dopamine in the brain. By restoring the signal, it helps reduce the overactivity of the pituitary gland and lowers excessive hormone production. However, medication is only one part of the management. Daily care plays a critical role in maintaining the health and comfort of horses with PPID. For example, dietary management is essential, especially for horses that are also insulin dysregulated. Feeding low-sugar, low-starch diets helps reduce the risk of laminitis and metabolic complications. Regular farrier care is crucial, particularly for horses that have experienced laminitis. Proper hoof balance and early intervention can make a significant difference in long-term soundness. Because horses with PPID have weakened immune systems, they also require constant preventative care, including dental work, parasite control, and prompt treatment of infections or wounds. Many horses benefit from body clipping, especially if they develop long coats that make it difficult to regulate body temperature. Routine veterinary monitoring, including follow-up blood tests, is important to ensure that treatment is working effectively and to adjust medication as needed. With proper management, many horses with PPID can continue to be ridden, exercise, and enjoy for many years. Cushing's disease is not simply a part of aging. It is a complex, progressive condition that affects the brain, the endocrine system, and the entire body. Understanding the science behind PPID allows us to recognize it earlier, treat it more effectively, and ultimately improve the quality of life for horses in our care. Because in the end, recognizing the difference between just getting older and a treatable disease can change everything.